Then, of course, you have that social media diet, celebrities postings on social media and it says, what I eat in a day. And, they find it on TikTok.
Hello and welcome to Cocoa Pods, a podcast of the Birth Center for Natural Deliveries Foundation. My name is Dr. Bola Sogade. I'm the host of this public education podcast. Today, we're fortunate to have with us Dr. Sesi Dosunmu-Ogunbi. Welcome, Dr. Sesi.
Oh, you pronounce that quite well, Dosunmu-Ogunbi. Not many people can do that. Well, greetings to everyone. I'm so excited to be here. Thanks for the invite. And this is my first podcast, so I'm really excited about this. We're going to have fun.
Yes, we will. Thank you. So Dr. O is who we refer to as a pediatric GI. That is, she's a pediatric gastroenterology specialist. And we're going to have her tell us basically what that means. And she has over 35 years of experience in the medical field. She graduated from University of South Alabama College of Medicine and did her fellowship at the Emory University in Atlanta. So Dr. O, what is a pediatric gastroenterologist?
Well, a pediatric gastroenterologist is a doctor that specializes in gastrointestinal. Gastrointestinal means stomach problems in children. So I'm sure a lot of people have heard that going to their gastro doctor, they think mostly of adults, but we also have the specialist that actually does this just in children as well. So that's what a pediatric gastroenterologist is.
Wow, thank you. So I'm going to ask this question, are you as a young woman having symptoms that interfere with digestion? Are you having problems eating or swallowing? Do you have reflux or regurgitation, nausea, vomiting, abdominal pain, bloating, gas distension, difficulties stooling, diarrhea, constipation, weight loss, or growth problems? Then you really want to listen to what Dr. O has to say today in our podcast. Dr. O will be talking to us about some gastrointestinal conditions and situations, such as the FAD diet, fatty liver, and any bleeding from the upper or the lower GI, that is gastrointestinal tract. So welcome, Dr. O.
Thank you.
So, I talk about a real life situation in which Abim is a 16-year-old high school student who is very conscious about her weight and appearance. She's heard about a popular diet called the watermelon cleanse from her friends and social media influencers. This diet claims that eating only watermelon for 3 days will help detoxify the body, boost metabolism, and lead to quick weight loss. And Abim is excited to shed some pounds quickly. Abim decides to try the watermelon cleanse during a long weekend. So, Dr. O, how should we, or Abim's primary care doctor, counsel her? Abim now is at the end of the second day of this watermelon cleanse. She's feeling weak, tired, and irritable, and her energy levels have plummeted, and she's struggling to concentrate on her homework. So how do we counsel her, and what is this type of dieting called, Dr. O?
Well, no doubt Abin is having some complication from this diet. So, of course, the quick answer is you don't need to do this diet because obviously it's not sustainable. So this diet, you've heard of FAD diet, FAD diet, is an intentional plan for eating that reports significant health benefits. And this watermelon diet says you're going to have weight loss, you're going to have a removal of toxins, and some of them claim that they will decrease inflammation and hormone balance and many other things. Some of them will include elements of restricted eating, that you can't eat anything. Like in Abby's case, she can only eat watermelon, and they may encourage you to include a specific type of product or ingredient or supplement to your diet. So that's a FAD diet.
Like FAD.
FAD, yes,
Okay.
FAD, yes.
Yeah. So why are fat diets so appealing?
Well, we live in a diet culture. It's so ingrained in our system. A lot of people get information from social media. The social media tells us what we eat, what our body needs to look like, and people think, the fat diet makes eating feel like you're exclusive. Like people think that it's kind of hip to be on a gluten-free diet, even if they don't have celiac disease. There's this belief that food is medicine and that if you eat certain food, it's unhealthy, which is true, but they take it to a different level. And then there's this promise that it will provide quick results, like in Abby's watermelon diet, that we're going to see real quick results from that.
Yeah.
All right. And the truth about this is that this diet is just not, it's just too restrictive. Can you imagine?
So what are the truths about fat diets?
Yes. The truth about it is that it's very restrictive. It's very restrictive. It leads, it kind of gives you that poor relationship with food and, it can lead to eating disorders. And then, of course, can affect your hormone balance. And it lacks medical oversight. Again, most of us get their information from social media. They don't consult with their doctor before going on this diet. And food is just one factor to health. There's other factors about health, like you're exercising, how much you're sleeping. So there's no one diet that is perfect. It's the way you eat over a pattern of time, your eating habits over time that matters.
Hello and welcome to Cocoa Pods, a podcast of the Birth Center for Natural Deliveries Foundation. Today, we're fortunate to have with us Dr. Sesi Dosunmu-Ogunbi. We're going to refer to her as Dr. O during this podcast. Thank you for coming to Cocoa Pods, Dr. Sesi.
Oh, thank you for inviting me, Dr. Shogede. You pronounced that very well, Dosunmu-Ogunbi. Not many people can do that. I'm so happy to be here, and thanks for inviting me. And I will tell you, this is my fourth podcast, so I'm looking forward to this, and we're going to have a lot of fun.
Your first?
My very first one.
Okay, good.
Yes,
good.
Thanks for inviting me.
Thank you. So I'm going to ask this question. Are you, as a young woman, having symptoms that interfere with digestion? Are you having problems eating or swallowing? Do you have reflux or regurgitation, nausea, vomiting, abdominal pain, bloating, gas distension, difficulties stooling, diarrhea, constipation, weight loss, or growth problems? Then you really want to listen to what Dr. O has to say today in our podcast. So Dr. O is who we refer to as a pediatric GI. That is, she's a pediatric gastroenterology specialist. And we're going to have her tell us basically what that means. And she has over 35 years of experience in the medical field. She graduated from University of South Alabama College of Medicine and did her fellowship at the Emory University in Atlanta. So Dr. O, what is a pediatric gastroenterologist?
Well, a pediatric gastroenterologist is a doctor that specializes in gastrointestinal. Gastrointestinal means GI, stomach and stomach problems in children. So I'm sure a lot of people have heard that going to their gastro doctor, they think mostly of adults, but we also have the specialist that actually does this just in children as well. So that's what a pediatric gastroenterologist is.
Wow, thank you. So, I want to give a real life situation in which I have a teenager client, and we're going to use the fictitious name Abim for this client. She's a 16-year-old high school student. She is very conscious about her weight and appearance. She's heard about a popular FAD diet called the watermelon cleanse from her friends and from social media influencers. This diet claims that eating only watermelon for 3 days will help detoxify the body, boost metabolism, and lead to quick weight loss. Abim is excited to shed some pounds quickly. Abim decides to try the watermelon cleanse during a long weekend. So I pose this question to you, Dr. O. How should we counsel Abim now that she is in the second day of this water cleanse diet? She's feeling weak and tired, irritable. Her energy levels have plummeted. She's struggling to concentrate with her homework. So, what is this type of dieting called? And can you tell us a little bit about this kind of dieting?
Well, no doubt Habin is having some complications from this diet. She picked the watermelon diet. So she definitely, the quick answer is she needs to stop. She's definitely not sustainable. And this diet is called fad diet, FAD, fad diet. It's an intentional plan of eating that reports significant health benefits. In her case, this watermelon diet claims that you're going to have weight loss, you're going to remove toxins, and you're going to improve your energy. Some of them may claim that it will decrease inflammation and hormone balance, among other things. It may include some elements of restricted eating, like in her case, just only watermelon. And some of them may encourage inclusion of a specific product, ingredient, or supplement.
So, but why are fat diets so appealing? I mean, why did Abim choose to do this over a long weekend?
Well, diet culture is so ingrained in our society. We live in a social media. Everybody gets their information from social media. The social media tells you what food you need to eat, what our body needs to look like. And something that when you're on this fat diet, it makes eating feel exclusive. People who are on a gluten-free diet that don't have celiac disease feel like, I'm on a gluten-free, they feel it's hip to be on a gluten-free diet. There's this belief that food is medicine, and the belief that certain foods are unhealthy, which is true, but they take it to a different level. And then they promote that it will provide quick results, like this watermelon diet that Abin is on.
Wow. So, but what are some of the truths of a fat diet? Just talking to you as a specialist in this area.
Well, this diet is so restrictive, they're all very restrictive. The early diet, at least, it kind of gives you that poor relationship with food, and it can lead to potential, especially in young girls, to eating disorder, can cause problems with your hormone balance and, affect your bone density. It lacks medical oversight. Most of these people on this diet are getting their information from social media, and they're not consulting with their doctor. And food is just one aspect of health, one just factor. There's other factors that affect your health, like exercise and much sleep you're getting. And there's no one perfect eating, food diet. It's just your pattern of eating over time that matters.
Wow. So what are some common examples of fat diets?
Well, I would divide them into like maybe 3 categories, and I'll talk more about them in a little bit more. So you can divide them into a time restricted diet, you have the forbidden food group, and then you have the social media diet. In the time restricted diet, there are different types. You've heard of the intermittent fasting, where people will fast for 14 hours and then eat within a 10-hour window, or they have the 16 hours of fasting, and some even take it where they they fast for 20 hours and only for 4 hours. And then you have that warrior diet, where they eat very little in the day and they eat a very huge meal at night. And then you have the eat stop eat diet, where they eat normal for 5 days, and then the remaining 2 days of the week they eat like very, very low amount of calories, like maybe 500 calories. Then in the forbidden group diet, you have this encourage using help promoting food and reduce or eliminate food groups that contain harmful nutrients, like they could tell you to eliminate grains and meat, fruits, legumes, starchy vegetables. I'm sure you've heard of the keto diet, the vegan diet, the carnivore diet, where you just eat meat. I thought that was kind of interesting. And of course, there's so self-diagnosed diet on those who are on gluten-free diet. So then of course you have that social media diet. There's this diet where celebrities posting on social media, and it says what I eat in a day, and they find it on TikTok. Then you have that glorified food and supplement, like the ginger drops and the apple cider vinegar diet. You have this lemon coffee, and then you have those that do calorie counts, where the celebrity will do the calorie counts and calorie deficit diet. So you hear about all of these different diets, that are out there, or that are called fat diets.
Well, is there a good diet that you can be on?
Well, obviously, I can, there's all of these diets are not, there's no, definitely no, there definitely risk and complications you can have from these diets. But we can talk more about that if you want me to, about some of the concerns that you have about the restricted diet, So like those on restricted diet, they have difficulty meeting their macro and micronutrient. Macro is like your fat, your protein, your carbohydrate, and the micronutrients are your vitamins and your minerals. So if you're on just all this restricted diet, you're not able to meet all those nutrient needs. And it's dangerous for certain health conditions, like for someone who has diabetes. Can you imagine, and you're taking an insulin and you're on a restricted diet, so that will work. And there's some people are on medication that they have to take with food. Like if you have to take iron, some on antidepressants that they have to take their medication with food. And, so it doesn't, and there's no studies that shown that of any benefits of this than eating any scheduled meals. There's a concern in those with the forbidden diet. They're at risk of having nutrient deficit, because you're restricting food. You say you can eat this, you can eat the grain, you can eat meat, you can eat this one. And so they're at risk of certain things like, vitamin D, calcium deficiency, vitamin B12, zinc, fiber, magnesium. So there's this risk of all of this, by restricting your diet. And it's not sustainable. There's that psychological impact you can have from being on a restricted diet, the anxiety. Can you imagine if Abin, for example, had to, call to friends to go out and eat for dinner, and she's on this watermelon diet, and she says, "Oh, I can't eat." She feels isolated. She can't hang out with her friends because she's on a diet. So it's just, and that creates anxiety. And then we're seeing a lot of this, in the society right now. So adding this other factor of being on a diet just adds more to that. And we don't know what the long-term consequences of this Then, of course, that's social media diet. Of course, a lot of these people that are posting on celebrities that are posting on social, they have the eating disorders, and a lot of these young people are copying their habits, and the trend is so extreme, and it's just so harmful to health. Like Abin, what can you imagine just eating watermelon for 3 days? It's absolutely, what is a watermelon? Sugar and just water. That's it. So eating that, not getting any of those nutrients. So it's just too extreme, and some of this lemon coffee, there's high concentration of caffeine in that diet that some of this can even cause heart problems. So they need to be, so there's a lot of risk with this fat diets.
Well, eating healthily during the teenage years is crucial for a variety of reasons, and it can significantly impact a person's health later in life, including during pregnancy. There is a need to get the necessary nutrients for bone development and growth, a need to form good long-term habits, and a healthy diet during adolescence helps prevent nutrient deficiencies that are crucial during pregnancy for the proper development of the baby and for the mother's health.